Many of the patients who come to gastroenterologists, and particularly in our practice, digestive and liver disease consultants here in Houston, often they complain about bloating. Perhaps 1 out of every 3 patients, their primary complaint of visiting a gastroenterologist today is about bloating. Now, sometimes patients may not correctly use the term bloating, but we as doctors or gastroenterologists, and particularly in our clinic, we identify bloating by certain things when patients tell in their history. That they feel their stomach is distended after they eat, they feel uncomfortable, sometimes they cannot wear their clothes, they feel very tight, and sometimes bloating is also associated with belching, with burping, or passing excess gas in terms of flatulence. So bloating can be a very annoying problem in our communities at the end of the day. Now, what can cause bloating? Often bloating is associated with the foods that we eat. In the long list of foods, what causes bloating, different races have different reaction to the foods in terms of developing bloating. In our patients, we always talk about, for example, gluten. Gluten sensitivity is one of the things. Gluten is a protein which is present in wheat and wheat products. So one needs to be, you may not have a celiac disease from gluten, but you can be sensitive to gluten. So no blood test would help us to diagnose this. It is only by asking the patient, how do you feel when you consume wheat and wheat products? So one cause of bloating could be from that particular issue. Second is lactose intolerance. Lactose is present as a carbohydrate in milk and milk products. Although in North America, particularly in the United States of America, lactose intolerance is not as common as what we see in the Hispanics or the African American population. Lactose intolerance is more prevalent in the Asian population. For example, India, 60% of the people or 100% of the Orientals have lactose intolerance. But 30 to 40% of the Americans also develop lactose intolerance, which can be the biggest cause of bloating. So when you talk about milk and milk products, we are not only just referring milk in the form of consuming in tea and coffee, but it can be associated with eating ice creams, it can be associated with eating yogurts, it can be associated sometimes in extreme form of lactose intolerance with various types of cheeses, etc. The third most important thing that has emerged in the last few decades, what we call as bacterial overgrowth syndrome, small intestinal bacterial overgrowth. So what does that mean to you all? Basically, it means that we have trillions of bacteria in the human gut. When there is a perturbation of this bacteria, which means to say, when the bacterial composition changes, then one can develop and suffer from bloating. Now, why does this bacterial composition change? It changes for a variety of reasons. Again, what you're eating, what medications you're on. People take often antibiotics that can disturb the bacterial flora. Or if you're suffering from another chronic disease, which can also affect this bacterial flora. So small intestinal bacterial overgrowth syndrome has truly taken the center stage today in terms of causing bloating in the human population. Hence, there is so much of focus on gut microbiome and how to alter the gut microbiome to help patients from reducing bloating. So when we see patients in our practice, we pay the greatest attention to the history of the patient. And some of these problems do not necessarily need medication. It is good, proper clinical advice by a doctor and helping the patient how to cope with this by identifying the triggers becomes extremely important, which is patience for the doctor and patience for the patient. This is not something we can solve, just by giving something, but this can be solved together with good conversation, identifying the issues, and helping the patient, which is our goal at all times at Digestive and Liver Disease Consultants.